Okay, so what they do is urinary system, they get rid of the nitrogenous waste. So they remove the waste products from your body. That waste product is containing nitrogen. So they're getting rid of nitrogenous waste mainly. Okay. So that part is called excretion, and that is why sometimes urinary system is known as an excretory system. Now, while it sounds easy, but while doing that, they do a lot of other job as well. Okay, it is like if you want to get rid of the trash in your kitchen. Think about it. In your kitchen, when you cook, you have a trash. Let's say you're lazy, so you didn't get rid of the trash every day, so it's 5 days old. Okay, so what happened then? Then if you are not only getting rid of the trash because it is the trash, you're getting rid of because it smells bad. It attracts flies. It attracts Drosophila like fruit flies, blah, blah, blah. Lots of other things you're affected with. Same thing here. So when you're getting rid of the waste, it's not just, oh, I just got rid of the waste. By doing so, you are doing a lot of favor to the body, meaning you're maintaining a homeostasis of the body. How? You regulate the blood volume and blood pressure. So depending on how much water to getting rid of, you're maintaining the blood volume because the waste coming from the blood anyway. You are maintaining plasma ion concentration, meaning how much sodium, how much bicarbonate, how much phosphate you want to lose, or how much hydrogen ion you want to lose, all these things. So obviously when it comes to hydrogen ion, you are talking about blood pH also. So you're maintaining all these ionic balance and blood pH. You're conserving nutrients. Nutrients you don't want to lose. You want to lose only the waste. So you're keeping the glucose, you're keeping the amino acid, you are keeping the vitamins, you're keeping some minerals that you need, all of this. Apart from that, the kidney, you learn in endocrine system that it's a gland. It's a hormonal gland or endocrine gland. So it produces an enzyme, erythropoietin and calcitriol. Those two enzymes, hormone, erythropoietin and calcitriol, those two hormones, calcitriol from the name, they're responsible for calcium homeostasis. Erythropoietin, you learn in blood cell production that it actually regulates the RBC production. Renin, on the other hand, some books call it hormone, some books call it enzyme, because this is a hormone, meaning if it works like, it behaves like a hormone, means it's secreted in the neighboring tissue fluid and then travel by the blood and works in a target place. But some books also call it enzyme because it behavior like an enzyme. It has an enzymatic activity to maintain the blood pressure. How they do it, this one we are going to learn later on, like how renin control the blood pressure with their enzymatic activity. We are going to learn that later on. Okay, so that's basically in general the function of the urinary system. Now, how they exactly do these things? They have two kidneys. So we born with two kidneys. Some of you, as I said, you can born with one kidney as well. So if you're born with one kidney, only thing that is that you have one kidney. Other than that, everything is same, meaning you can produce or you can maintain your homeostasis exactly same. Okay. Those two kidneys, their location are called retroperitoneal, meaning behind the peritoneum membrane. So those two kidneys located retroperitoneally. They are connected with the ureter, which is a pipeline that brings the urine to the urinary bladder. That's the only function of ureter. Urinary bladder temporarily store the urine. That's the only function of urinary bladder. And urethra, which get rid of the urine to the outside of your body. So that's, again, the only function of the urethra. So if you know their structure, like ureter, urinary bladder, and urethra, function is pretty simple. And then we come back to the kidney again. Like where they're located little bit posterior to the body. Like in the abdomen, they're towards the back. So they're right on the, supported by the 12th rib. So they're located on the back side of the body, and then the peritoneal membrane go. Both kidneys, if you have two, both of them, like two of them are not on the same height. Like my eyes are on the same height, okay, along the same height. So an ear on the same height. So on, but the kidneys are like this. Your right kidney is slightly inferior compared to the left because the right lobe of the liver is huge. So because that requires a little bit space on the right side, your right kidney is slightly inferior compared to the left kidney. Other than that, both are the same, like they do same functions. So the kidney produces the urine and that goes through the ureter, comes to the urinary bladder temporarily store it, and then it releases whenever required by the urethra. People often confuse with these two words, ureter and urethra. Ureter is the one that brings the urine from the kidney to the bladder. Urethra is the one that goes from the bladder to the outside. Just another picture to explain where the kidneys are located. This is the posterior view, so it's towards the back. That's why some people, when they have like kidney stone, which can cause a lot of pain, people feel the pain in the backside more. That's like a symptom. You can say that this is how they look inside the kidney. So if you make a sagittal cut, like if you could make a long cut, you will see inside is like this. They have a pyramidal structure, and this portion, like all the way outside portion, is called renal capsule. So it's a capsule, and inside this stripe structure appeared. All the stripes appear because they have lots of tube. Those are tiny, tiny microscopic pipeline, a lot of them. These are like millions of nephrons. The cortex composed of roughly 1.25 million of nephrons. So these are millions of nephrons in each kidney. Now the question, what is nephron? Nephron is the functional unit of kidney. How it works, I'm going to discuss later on. Okay. Just right now, let's focus on how they look like. So these millions of nephrons are sitting here producing urine. Individually, one nephron can produce urine. So millions of them are producing at the same time, and they are going through this pipeline and eventually come it right here. So all these millions of nephrons, when they produce the urine, they eventually come through this pipe and come right here. There's a sink-like area, like a basin. That sink-like area is called renal pelvis, which then take the liquid to the pipeline called ureter, which you already mentioned, and ureter take the urine down to urinary bladder. So all the millions of nephrons that we have, they are producing a little by little and continuously urine, and that urine comes to this pipe, and then eventually it comes into this renal pelvis area and then go into the ureter. So now the